Had you ever tried acupuncture before?
Yes, I had. I think I had it at a chiropractor's office, and also another doctor in Long Beach treated me once with acupuncture, but he was just learning it himself, and he stimulated the needles by twisting them.
All right, and so you had a combination then of practice by Dr. Tong, which used acupuncture and various other methods to alleviate the problem you had?
Yeah, the most effective was the injection, the one I hated the most because it was very painful at first, but it's also the one I liked the most because that's the one that worked the best.
That brought it around.
Yes.
The injection technique that you used, was that based on acupuncture theory that you learned?
It's based on both, okay? Some of them are peripheral nerve blocks that are learned by anesthesiologists. Some of them are anesthetic injection into different acupuncture points to open the blockage along the energy channels. So the energy flows to the area that are deprived of circulation. And the nerve block works the same way. Any area that are tight, okay, you release the muscle spasm, the blood flow will flow in the area. It treats everything. It really, in his case, just acupuncture alone will not work.
But so the combination of
we use an epidural. I freeze his nerve 3 times with cryosurgery, and then freeze his nerve with a chemical called phenol, and that's how we can reduce a lot of spasticity. That's why the combination of the two, the best of the two systems, is unbeatable.
You were fascinated, I'm sure. And feeling well now, and still undergoing some treatments as well?
I'm feeling much better. When I began, I was just depending on Dr. Tong. I just woke up in the morning and made breakfast, and if I wasn't going to see him, then I laid in bed and watched TV.
And now you are the editor of the Viking newspaper, Long Beach City?
I'm the editor, and I tutor other students 20 hours a week, and I still get a treatment from Dr. Tong once every 2 or 3 weeks.
He's a very educated man. Is it fascinating what he did?
Yes, it is fascinating because I didn't believe, the first treatment was very interesting. I was mad because he had me laying on the floor. I had to get out of my wheelchair, and I don't like to be in that position, and he was injecting me with these needles. And
so it was just a phenomenal thing?
But when he got me back in my chair, I said, God darn, the pain's mostly gone, and so I feel great, and I was really happy. I went out and partied that night by myself.
We've got some callers, I know, that want to talk to Dr. Tong, and I will take them, and Dr. Tong, you will speak to them right over here. That's where they will be coming from. First caller is Paul. Hi, Paul. How are you?
Hi, John. I'm fine, thank you. Hi to Dr. Tong also. John, I just wanted to attest to the fact that approximately 3 years ago, I was afflicted with a very debilitating virus, which is commonly known as chronic fatigue syndrome. The result was extreme fatigue, which made it almost impossible to get out of bed in the morning. When I was able to get up, I would place my feet on the carpeted floor, and it felt like I was stepping on sharp rocks. My hands were so painful that I hated to try and even shake hands with anyone. Before going to Dr. Tong, I was taking Voltaren, which is a rather strong drug, which also affects your kidneys and has an effect on your liver as well. My circulatory system was not even working properly.
How long ago did you see Dr. Tong?
I first went to Dr. Tong about a year and a half ago.
Okay.
And the day that I had my first treatment from Dr. Tong, I was so convinced that he could help me, I stopped taking the medication, and I've not taken any of it since then.
All right, thank you. We're going to take some more calls because we want to get him in. Thank you, Paul, very much. Is Paul an unusual case, or a chronic fatigue syndrome something that can be treated?
Chronic fatigue syndrome cannot be treated with the traditional way, which is drug, okay? We have support group for this kind of disease all over the United States. But everybody, every month, inviting experts here, waiting for a miracle drug. What the misleading thing was that we have a phenomenal success with antibiotic treating acute infections. They try to duplicate that in chronic problem, which is a much more complex problem. In fact, each chronic patient, we have a lot of chronic fatigue patients out in the audience right now that I help a lot, okay? They have different combination of pathologies. You'll never find one single drug or combination of drug that will treat this problem, okay? You have to improve the circulation to the area that have been deprived of circulation.
That's what we want to get into after we take a couple of these phone calls, is that particular facet of it. Hi, Mindy. How are you?
I'm fine. How are you tonight, John?
Very good.
Dr. Tong is the most wonderful, generous, caring man in the world, along with his staff. My mother, Dorothy, who has very bad arthritis and is an elderly woman, has been in a wheelchair for over 10 years. Sits at home, rocks, cries with pain, and all the doctors gave up on her. From the suggestion of some other Dr. Tong's patients, we finally went to go see him to search out other ways. And after just 4 treatments, she does no longer take pain medication. She walks with no pain. She does not sit and cry, and she chases the little 3-year-old around the house.
All right.
So his office is the most professional, caring people, and it does work.
All right. Thank you very much. And, of course, the office we're speaking of is at 3816 Woodruff, and it's the Woodruff Medical Clinic. And we'll put a phone number up in a moment for you after we talk to Debbie. Hi, Debbie.
Hi, I was diagnosed with carpal tunnel syndrome in both hands and tendonitis in one arm. I did have the surgery 6 months ago on one hand, and a couple of months ago it started acting up again. And my doctor said that I should expect this. Now, I'm wondering if will acupuncture help out with this?
Yes, absolutely. We have helped many people. Like, pretty simple. It's much more difficult now that you have surgery. If you haven't had surgery, it's a lot easier.
But can she still be helped?
Yes, yes.
We're going to put a phone number up. What we told you about earlier, and people have said, well, okay, if this is such a breakthrough, where is the American Medical Association? And Dr. Tong, tell us what you're doing with that.
Okay, I am planning to submit the data of all the people that we have helped. Some of them are really called incurable, except giving drugs like lupus, like chronic fatigue, even emotional problems, PMS, depressive disorders. We had cured many of them, or helped many of them, okay? But why I've been hesitating, number one is, I think I'm going to be putting a lot of people changing the manner of practice, okay? However, as a physician, the number one rule is that do thy patient no harm, okay? I do feel that masking the symptom with drugs or doing a lot of surgery is very harmful to people, okay? And now that I truly discover a way to cure or reverse almost all chronic problems. Yeah. Say again?
No.
Oh.
That this is the American Medical Association then will opt to publish or not publish your findings.
I think correct? If they're smart, they ought to do it, okay? Because we have a health mess.
Right.
Very expensive, okay? A lot of tests are being done, diagnostic tests, high-tech medicine, okay? Everything geared to describe a very precise diagnosis, but nothing on treatment except drug and surgery.
This is a man. This is a man who has, in effect, found out how acupuncture works.
No, correct that. Okay, I found out how the Chinese
found out.
I discovered how they do. Yeah, I don't want to take credit for that. Yeah.
You told one thing, and I want you to tell it to me so that people out there can see the graphics of it. You're talking about the channels of energy, and you said picture your body as if it is, and give me those definitions again.
Okay. First of all, let me just describe a little bit so you understand. Okay, we are a summation of cells. Okay, cells need circulation. Circulation is primarily the most important thing to keep the cell alive. It gives, number one, the oxygen and nutrition. Number two, it defends against foreign pathogens like the virus, bacteria, or parasites. Okay, and thirdly, it cleans up all the toxins for metabolism. Okay, you cut off an area of circulation, the cells get hungry or die, and you got problems. Okay, so as a group together, we also need circulation. You know, you can picture yourself like California. Okay, this is Sacramento, San Francisco, Los Angeles, El Toro, and San Diego. So it doesn't really sound incredible how a traffic jam down here in El Toro can back up all the way to Sacramento. Okay, if the traffic jam is unattended day after day, month after month, year after year, you'll back it all the way up there. And if you relieve the traffic jam here, things start flowing. That's why a point down the knee can treat jaw pains, facial pains, sinuses, and headaches. And once you know the map and you know all the nerve, how you can adjust these spastic muscle, the pain, relieving the pain, and improving the energy, you can almost treat anything.
And that is what we want you, if you would like to contact for more information. This is Dr. Tong. Dr. Tong, we run out of time. I want to thank you very, very much for coming by.
Yes.
Good luck to you.